The early 20th century saw psychiatry grappling with a new wave of psychological distress. World War I left countless soldiers with debilitating emotional and mental scars. These veterans experienced vivid flashbacks, nightmares, and intense anxiety. Doctors struggled to understand these symptoms, often attributing them to shell shock or war neurosis. World War II brought further attention to the psychological impact of combat. Soldiers returned home with a range of invisible wounds. Psychiatry, however, still lacked a comprehensive understanding of trauma. Treatments were often ineffective, leaving many veterans feeling isolated and misunderstood. The medical community began to recognize that traumatic experiences could have lasting effects on the mind. However, there was no unified diagnosis or treatment approach for what we now understand as post-traumatic stress disorder or PTSD. The stage was set for a shift in how psychiatry viewed and addressed trauma. The mid-20th century witnessed a significant shift in psychiatry. Biological models of mental illness gained prominence. This led to increased emphasis on medication as the primary treatment for conditions like depression and anxiety. While this approach offered relief for many, it inadvertently overshadowed the profound impact of trauma on mental health. The focus on brain chemistry and pharmaceuticals led to a decline in exploring the psychological roots of suffering. Trauma, with its complex interplay of memories, emotions, and bodily sensations, did not easily fit into this biomedical framework. As a result, many individuals struggling with the aftermath of traumatic experiences found themselves overlooked or misdiagnosed. This shift towards biological psychiatry had both positive and negative consequences. While medications provided much-needed relief for some, they often failed to address the underlying trauma that fueled psychological distress. The emphasis on medication also inadvertently created a barrier for recognizing the importance of psychotherapy and other holistic approaches in healing trauma. The stage was set for a renewed understanding of the profound impact of trauma on the human psyche. The year 1980 marked a turning point in the relationship between psychiatry and trauma. After years of advocacy by war veterans and mental health professionals, PTSD was officially recognized as a distinct diagnosis in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-3. This inclusion was a watershed moment. It acknowledged that trauma could have a profound and lasting impact on mental health. The criteria for PTSD included exposure to a traumatic event, re-experiencing symptoms like flashbacks and nightmares, avoidance of trauma reminders, negative thoughts and feelings, and hyperarousal such as startle response and difficulty sleeping. The inclusion of PTSD in the DSM-3 was a victory for countless individuals who had silently endured the invisible wounds of trauma. It provided validation, reduced stigma, and paved the way for more targeted research and treatment. However, the journey towards a comprehensive understanding of trauma and its treatment was far from over. The next challenge lay in integrating this newfound knowledge into mainstream psychiatric practice. Section 4. Finding the balance, medication, and holistic approaches to trauma. The recognition of PTSD in the DSM-3 sparked a surge in research and clinical interest in trauma. Psychiatry began to grapple with the complexities of treating trauma, moving beyond a solely medication-based approach. Medication, while helpful in managing some symptoms like anxiety and depression, often proved insufficient in addressing the core issues underlying trauma. This realization led to a growing appreciation for the role of psychotherapy and other holistic approaches. Therapies like cognitive behavioral therapy, or CBT, and eye movement desensitization and reprocessing, known as EMDR, emerged as promising treatments for PTSD. These approaches focused on helping individuals process traumatic memories, manage overwhelming emotions, and develop coping mechanisms. The challenge for modern psychiatry lies in finding the right balance between medication and holistic treatments. Each individual's experience of trauma is unique, requiring a personalized approach that considers their specific needs and preferences. Section 5. The hidden language of trauma PTSD in children and adults. While PTSD affects individuals of all ages, its presentation can differ significantly between children and adults. Children, with their developing brains and limited verbal abilities, may express their trauma in ways that are less overt than adults. Adults with PTSD often experience flashbacks, nightmares, and intrusive thoughts. They may avoid reminders of the trauma and struggle with emotional numbness or outbursts. Children, on the other hand, may exhibit regressive behaviors, such as bedwetting or thumb-sucking. They may have difficulty concentrating in school, exhibit clinginess, or show increased aggression. Recognizing the signs of trauma in children is crucial for early intervention. Early treatment can help mitigate the long-term consequences of PTSD and foster resilience. Understanding the unique ways in which trauma manifests in different age groups is essential for providing appropriate and effective care.